New at 10, deadly diseases once practically extinct, turning into outbreaks all over the country.
And the CDC is linking those outbreaks to pockets of people who are not vaccinated. The I-Team's Casey Geraldo discovered some of them are in classrooms across southeast Wisconsin.
We searched through state data and found dozens of schools where at least a third of kids aren't fully vaccinated or vaccinated at all. And a children's hospital doctor tells us that means those communities aren't protected from an outbreak.
When it comes to their kids, no parent has it easy.
Well, I think every decision with having a child is a scary decision.
But Lorena Terreno says when it comes to vaccines, for her, it's cut and dry.
The science is behind what vaccinations do to protect our kids.
That's not how all parents feel, though. Wisconsin data shows in 2017, more than a quarter of 2-year-olds in southeast Wisconsin didn't have their full recommended series of vaccines. And some schools in our area have far fewer vaccinated children than that.
It concerns me, but it doesn't surprise me.
In Milwaukee Public Schools, 89% of students have their vaccines. But at Mount Zion Christian School in Lake Geneva, just 11% of students are fully vaccinated. At McGuanago Baptist Academy, it's 30%, 31% at Falls Baptist Academy in Menominee Falls. And at Prairie Hill Waldorf in Pewaukee, just under half the kids have all their vaccines. Prairie Hill Waldorf sent us some information about their policy. It says, in part, Prairie Hill Waldorf School encourages parents to consider their civic responsibility in regards to the decision of whether or not to immunize. The school says it recognizes a parent's decision and allows them to make choices in accordance with state law, which gives parents the choice to waive vaccines for health, religious, or personal reasons. For example, some parents withhold vaccines because they believe they can cause autism. But a large study released this month discredits that belief.
Are parents who don't vaccinate or under-vaccinate their children putting their kids and other kids at risk?
Absolutely.
Lynn Ranta, a pediatrician at Children's Hospital of Wisconsin, believes Wisconsin's law could stand to change.
Looking at our personal exemption language would be really something that I think would be important to do.
We found some schools where as little as 11% of the students were fully vaccinated to where they should be.
All it would take is one person who traveled to an area, for instance, where there's measles to come in, and 90% of those unvaccinated children are going to get a disease like measles.
Right now, measles outbreaks have been reported to the Centers for Disease Control in New York, Washington, Texas, and Illinois. Marquette University sent a health advisory to students earlier this year after a reported mumps case. The MMR vaccine provides protection from both diseases. For the parents we talked to, it's simply not worth the risk to their kids or their neighbors.
Your decisions affect everyone else, from whether you barbecue in your backyard or you vaccinate your children.
We did reach out to some of the other least vaccinated schools in our area. They either didn't get back to us or didn't wish to comment. Ranta tells us even if a person wasn't fully vaccinated as a young child, it's not too late to get those vaccines. You can find your school's vaccination rate right now on the interactive map at TMJ4.com. Casey Geraldo, today's TMJ4.
Great information, Casey. Thanks.